In a national study, college students' self-reported state of their mental health fell to about 50%, the lowest level ever. News 18's Holly Campbell reports what treatment is available and what might be behind the decline in health.
Like many other college counseling centers across the country, we have seen more students coming to the university with histories of mental health treatment behind them already.
Purdue Counseling and Psychological Services Director Susan Prieto Welch says why students are seeking help has changed over the past couple of years.
Anxiety is the #1 presenting problem, followed by depression. Historically, depression has been #1, but has been surpassed by anxiety in the last few years.
A University of California study surveyed more than 150,000 first-year students from 227 four-year universities. Nearly 10% of the students surveyed reported they frequently felt depressed. 35% said they felt overwhelmed. Prieto Welch says there's a common theme among Purdue students seeking help stemming from financial pressure and pressure to perform.
Am I good enough? That could mean, am I good enough in school? Am I good enough to get into graduate school, to get into professional schools, to go where I want to go after this? Am I good enough socially?
When it comes to treatment, Prieto Welch says there are a lot of options for therapy and even medication. She says one of the most effective forms of treatment for college students is group therapy.
So much of what students are struggling with has to do with, is this normal? Is this natural? Am I alone in this? It can be really powerful to hear others struggling with pieces and parts of what our own struggle might be.
Students also reported they spend more time on social media than ever before. Prieto Welch says she doesn't believe social media causes depression or anxiety, but she says it does play a role. Holly Campbell, News 18.